as crowds prepare to fill Gerald R. Ford International Airport.
We're headed down to Sarasota, Florida for the first time.
Renee Copes and her family were catching a plane for spring break.
We're comfortable with flying. We are up to date on our vaccines. We believe in vaccinating, and especially with the measles.
The medical director of the Kent County Health Department says the state is seeing an increase in measles cases.
It is definitely something that we are watching closely. So there have been several reported cases of measles in Michigan in 2024. And so we are definitely keeping an alert and paying attention to what we see locally as well.
Dr. Nirali Bora says a decline in vaccinations has led to more cases. For ages 4 to 6, the Michigan measles vaccination rate was just over 89% in 2017. And in 2022, that number dropped to 84%.
It's not something that I've seen in practice. So measles was declared eliminated in the United States in 2000, meaning we don't have a constant presence of measles. We have definitely seen outbreaks. Like 2019 was a year when we saw many outbreaks and cases.
Dr. Bora says the vaccine is very effective and widely available.
The MMR vaccine, the measles, mumps, rubella vaccine, which children start at the age of 12 months for the first dose, is very effective. So it's a 2-dose vaccine series. The first dose is 93% effective. The second dose, with both doses, is 97% effective.
The health department is most concerned about the vulnerable and unvaccinated when containing the highly contagious virus.
Those are the people who are going to be at greatest risk for getting measles if they travel either to an international location or a location in the United States where we're seeing outbreaks happening.
If you had 2 documented vaccine doses, you're considered protected. Dr. Boris says people who were born before 1957 are also considered to be immune. In recent years, vaccine hesitancy has been a growing issue. During the pandemic, measles vaccination rates dropped, especially in low-income countries around the world.
People just weren't able to get the standard immunizations that they normally would get because their healthcare clinic was closed.